someone in your household gets COVID, what do you do? Traditionally, people waited, they monitored symptoms and then linked individuals to treatment, especially if they had any high risk conditions. But what if you could use an antiviral immediately in an exposed person and blunt the development of COVID? A new New England Journal paper addresses this question. Importantly, this isn't treatment, this isn't a new treatment. This is what we would call post exposure prophylaxis, or PEP for short, intervening right after exposure to stop infection from occurring. So, when you think about COVID, we've got more tools for COVID than any other respiratory virus. But what we haven't had is post exposure prophylaxis. For high risk people, there are pre exposure prophylaxis in the form of antibodies. We've got treatments, home diagnostic tests, obviously vaccines. But post exposure prophylaxis has been a major treatment gap. There's nothing you can do once you've been exposed except for wait it out. And if you're a high risk person, or maybe you live with a high risk person, that can be something that is very anxiety provoking. So this is an unmet need. This is an area where a tool, a scientific tool, would be really important. So there was a study recently published in the New England Journal of Medicine. It's called Scorpio PEP. PEP, remember, post-exposure prophylaxis. So what is this study? 2,400 people, household contacts of confirmed COVID cases. These people were negative at baseline. Now they're a household contact, and that's a high-risk encounter. A randomized controlled trial, and they start this drug, Ensitrelvir, 72 hours after exposure. And then they're followed to see, do they become symptomatic with COVID? They get this treatment for 5 days. It's 375 milligrams on the first day, and then 125 daily. When you look at the results, the placebo, 9% of people develop symptomatic COVID. So those are people who didn't get anything. But in the group that got Ensitrelvir, 3%. So 9% versus 3%. That computes out to a 67% relative reduction in symptomatic infection. That's pretty significant. That means like 2/3 protection. That's pretty good and remarkable, I think, in this type of a setting, because there's nothing else that you can do. Higher risk individuals, it seems to be even greater. So I think this is a clinically meaningful benefit for a drug that has a role now as post-exposure prophylaxis and will be something that will be added to the toolkit for COVID. So a little bit about Ensitrelvir. This is a protease inhibitor. It's the same class of drug as Paxlovid, although it doesn't have to be given with the second drug. Paxlovid is 2 drugs packaged together, nirmatrelvir and ritonavir. The other thing about it is that Paxlovid often has this taste problem. It's called dysgeusia is the medical term. Doesn't seem to be an issue with Ensitrelvir, so it's easier to give. Now the question is, how do we use this? So obviously, assuming that it gets FDA licensure and it's available, this is something that we should think about what the concept of operations are. Maybe in nursing homes, where an exposure could lead to life-threatening illness, immunocompromised people, other high-risk factors, people who just are too busy and can't afford to come down with COVID. So there's many different use cases for this. So I do think it's going to find value the general public is going to find value in it. I think it is something that really can add to the toolkit. And I think it sort of changes the paradigm. So I often talk in my videos about mastery of infectious disease. COVID-19 was something not even known to humans. Now we're at the point where we are gaining mastery over it. Yes, it still hospitalizes people. Yes, it still kills people. But in terms of tools, from vaccines, monoclonal antibodies, antivirals, home tests, immune modulators for severe disease, ventilator strategies, that's mastering of COVID-19. And now if we can get post-exposure prophylaxis in the form of a drug, that's more mastery of COVID, which is basically taking it from something that was a very, very serious illness for a lot of people to something that is very tame now, tame because of the tools that science and medicine have given us. And I really think that this is, a testament to the innovation that goes on, the minds that come up with these medications and do these clinical trials that we all owe a lot of thanks to.